Hi everybody, I'm Dr. Nasser. We're at the Acute Rehab Unit, Palmdale Regional Medical Center, and today we're going to talk about some equipment. The first piece is this thing above my head. This is called the Bioness Vector. This is a really cool device. I've worked in several rehab units and it's one of the very few places that has it. And this is primarily for people who have problems with their lower extremities. What that means is we take care of people who have amputations, strokes, brain injuries, spinal cord injuries. Obviously the amputated patients don't have a limb or two limbs below them, and the stroke or brain injured or spinal cord injured patients have significant weakness in their legs. For that reason, it's really great when a physical therapist can exercise that patient but take the weight of their body out of the exercise factor. So this really cool device, patients hang from it through a harness, and it's basically a de-weighted ambulation or de-weighted exercise. We used to do this in the old days with just over a treadmill, and we called it a suspended gait machine. This is a little bit more sophisticated because it allows the patient to turn and maneuver as opposed to just being on a treadmill while they're being suspended. So this is a really cool device. It will hold any patients that we bring here. I'm 175 pounds, and you can see I can just lift myself up. It's very, very strong, and it walks around the room. The great thing about this is there are a lot of safety risks with patients who have strokes or brain injuries or lower extremity amputations, and this is a very, very safe device. It's a lot safer than any of the other modalities that we would use for ambulation in these patients. The way that the nervous system works is it has a reprogramming effect. So when a patient that has a brain injury or stroke or spinal cord injury has the weight taken off and they're able to stand up and put partial weight on the remaining functional parts of their body, it's a re-education for the neurologic system to help fire the nerves into the injured area. And so therefore, suspended gait or ambulating on a device like this helps to reignite, so to speak, the weakened muscles or the poor balance that a patient has from that type of injury. It's all across the ceiling. It's in a serpentine type shape. So not only does this allow the patient to ambulate, but it gives them a simulation of community ambulation because they're walking around devices, they're making turns, they can walk forward and backward on the vector, and that helps quite a bit for re-education of the neurologic system to promote ambulation. The great thing about amputees is we bring in patients who bring in their prosthetics. Patients can walk for the first time on a new prosthetic while using this device, and helps the therapist to educate the patient on using the prosthetic and ambulating and walking with it as opposed to just trying without the device. So this is the Bioness Vector. It's extremely effective and helps us to advance our patients with lower extremity weakness or neurologic problems like stroke, brain injury, or spinal cord injury.